Okay, it's 6:30. We'll call this meeting to order of the Health and Human Services Board. As we have elections for chair and vice chair tonight, I'll start the conduction of the meeting and then we'll turn it over to the new chair. But first, we're going to do some introductions of our committee members. In person here, we have Michael Maestri. Paul Grohovic is not a committee member, but he is one of our supervisors on the Health and Human Services Department. We have Dale Schluter, Chris Ross, Carol Pearson, Dr. Sabrina Dunlap at the end. I saw her come in a little bit later. Jesse Betcher. And from the community also online, we have Dawn Pettit. So let the record show that this meeting has been publicly noticed to the news media as required by section 19.84 of the Wisconsin statutes. As clerk, I will now open the floor for nominations for the position of chair. Oh, I'm sorry, we have to go back up 1 second for roll call. Dale Schluter.
Here.
Marshall Savitsky. Jesse Betcher.
Here.
Michael Maestri.
Here.
Chris Ross.
Here.
Lorraine Gouget. Dawn Pettit.
Here.
Carol Pearson.
Here.
Dr. Sabrina Dunlap.
Here.
Let the record show we have a quorum, and now we can move on to the nominations.
And Madam Clerk, Marshall Savitsky did call and he may be coming. He had an emergency he was tending to at DNR.
Okay, we will note his time when he arrives. Hopefully he will be there soon.
I nominate Dale Schluter for chair.
1 second, 1 second. I've got to read the rules. I will now open the floor for nominations for the position of chair. Once the chair is elected, he or she will conduct the election for the vice chair. A person receiving a majority vote of members entitled to a seat shall be declared elected. This vote shall take place by voice vote. If no majority is reached, balloting shall continue, including all nominees, until a majority is reached. At this time, I will open the floor for nominations for the position of chair. Do I hear any nominations?
I'll nominate Dale Schluter for chair. I'll second that.
Do I hear any other nominations for the position of chair? Any other nominations? We'll call for a unanimous voice vote then for the position of chair going to Dale Schluter. All in favor say aye.
Aye.
Opposed? We have a chair and Dale Schluter. Would you like to conduct the election for the vice chair? Or would you like me to continue for that part?
Please go.
Okay, we'll now open the floor for nominations for the position of vice chair. Do we have any nominations for the position of vice chair?
I nominate Jesse Betcher.
Do we need a second on this?
You don't need one, but we can certainly take it.
I'll second it. Does the chair and vice chair need to be a county board supervisor, or can it be one?
It can be another as well.
Anybody.
So do I hear any other nominations for the position of vice chair?
Any others?
Last call for nominations for any other. Hearing no other nominations, we'll call for a unanimous vote for Jesse Betcher for the position of vice chair. All in favor say aye.
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 Any opposed, please say nay. Congratulations, we have a chair and vice chair. Mr. Schluter, we can turn the floor over to you.
We'll get even with everybody. Meeting agenda. Questions or concerns? If not, could I have a motion to accept?
Motion to accept.
Motion and a second made. Everybody in favor say aye.
Aye.
Passed. Public comments.
We had one, at least one turned in, and
Gave it to Dale. Okay. But I want to read this. At this time, members of the public will be given the opportunity to address the board on items on the agenda. Please adhere to the following when addressing the board. Comments will be limited to 3 minutes or less per individual. Comments should be directed to the board as a whole and not directed to individual board members. The board cannot respond to comments at this time. And please fill in the thing here. Okay, first one we have is, I'm sorry, I'm not certain. Who is this? Oh, Louise. Louise Ladenton.
I'm not on an agenda item.
Oh,
Pardon? Well, this is your, oh,
okay. Are there any hands up?
I do have one hand up.
who has their
Can you
hand?
read it?
Looks like Joyce Nowke.
Okay, can you hear me?
Yes.
Yes, go ahead.
Okay. I know that the SRC has closed the winter site. Oh, my name is Joyce Nufke. I live at N4440 Price Dam Road, Winter. And I know the SRC has closed the site, and I know that any donations that go to the SRC or say to Stone Lake or Exland or Winter are all to be shared with the SRC unless they're designated as for that, like that place. I know that they plan to remove the equipment out of there. My concern is that a 2016 commercial two-door refrigerator donated to Waldo by Waldo area residents. My understanding would be that that would not be the property of SRC. That would be the property of Waldo. That's my comment.
Thank you. Ms. Ladenton.
She's gonna wait till we.
Oh, you're waiting. Okay, that's right. Okay, moving on. Okay, has everybody had a chance to look over the minutes of the previous month's meeting? So do we have a motion to accept?
So moved.
Okay, motion, we have a motion, do we have a second? Thank you, yeah.
Who was that?
Deanna, or Carol, yeah. Everybody in favor, say aye. Motion
Aye.
passed. Committee reports.
I have been asked to read the LCO report since Ms. Bouger could not make it, so if that's okay, I'll.
Yeah,
just
that's
read the
fine.
report. Okay, dated 5/10, Ray Community Health Center has recently expanded our medical department patient hours of operation from 8 hours per day to 10 hours per day, Monday through Fridays. We will be scheduling patients starting at 7:15 a.m. and ending at 4:45 p.m. This is an effort to return to more normal patient managed care while COVID-19 infection rates remain slow. We are also opened up our urgent care center where we will be seeking walk-in same-day patients. Patients must call 715-638-5100 to schedule same-day walk-in patient care appointments. LCO Health Center is also providing second COVID-19 booster shots for those with comorbid health conditions such as diabetes, transplant patients, and other health impairments. Anyone wanting a COVID-19 vaccination, initial, second dose, or boosters can call the clinic at 715-638-5100 to schedule your appointment. LCO Health Center currently has 4 positive cases of COVID-19. Most recent cases are from non-vaccinated patients or from patients without booster vaccines. Most cases from vaccinated patients present much milder symptoms, as we have seen no hospitalizations for COVID-19 vaccinated patients. All contact tracing has been done. We continue to follow CDC guidelines for COVID-19, including hand washing, social distancing, vaccinations, and masking in patient care areas. And it was presented by Gary Gerard, LCO Health Center Director, Public Health Officer. That ends her report.
Thank you. Okay, Joy, Senior Resource Center.
Everyone should have a copy of my report. I'll just briefly kind of go over things. We still are in need of Meals on Wheels drivers at all sites. People are coming and going. Some people are, leaving because of family issues and stuff like that. We still need a part-time bus driver. Our present bus driver is having a few health issues with skin cancer, so he's gonna be missing some days and stuff like that. But we do now have a bus attendant for the bus, so that helps out a lot. Her husband also works at Hurricane Busing, and we're trying to talk her into learning how to drive the bus. So we're really close. Bob is working on her to do that. Okay. We need that. We still need an assistant cook in Epsilon. We now need an assistant cook in Stone Lake because Sherry gave her notice down there. She's giving us 2 weeks notice because she's got family concerns and issues, and we're really gonna miss her because she has really worked out well in Stone Lake. So we're looking for someone from Stone Lake in that area that's willing to help with Chris. Basically, it's when Chris is doing breakfast Monday through Thursday, helping get the bags packed for the home delivered meals and starting the lunch meal as Chris is finishing up breakfast. This Monday, we started opening up, we got approval from Julia. We've opened up now for classes and stuff like that. Jody started back doing her classes Monday, Wednesday, and Friday at the senior center versus doing them at Fitness Fanatics. Monday, she had over 20 people in her class, which is really good. We're having an issue with parking now because of all these people and all these cars. Bridge will start again on Thursday nights in June. It's a group that's been at the senior center for years. There's a morning bridge club. They haven't decided yet when they're going to come back. We have privilege cards and other games Monday through Thursday from 12:45 to 3. The art classes and the Wednesday group are pending. They're just what happened during COVID, a lot of people found other places to go. So some of them are just staying there because it's working out really well for them. Some of them, are coming back, which is fine. Okay, summer menu started on May 2nd. The meal counts that you have in there, they are estimates. When I give my report to Lynn, we don't have the final count yet. Our area site managers do not have to have their numbers into us until the 7th of May. My report has to be to Lynn before that. So this is an estimate. So now they're all in. It's the same thing with the deposits and stuff like that. Some of the sites send them in weekly. Some of them send them in every other week or at the end of the month. So Barb has to go through all of those. She has to match those, with the numbers. And then on the 15th of every month or the 5th of every month, all the site managers have to have their numbers into us. So we know how many people were there for a congregate, how many in Stone Lake were for breakfast, and how many home delivered meals we have. So when you get the numbers this time of the month for Health and Human Services, they're just estimates. They're not the actual numbers. The other thing is when you look at the deposits there, what's not included in the deposits, this is just what is collected at the sites. There are some sites that have people that are on the inclusive program or iLife. Those sometimes are a month to 2 months behind when we get payment for them. And the other thing to realize too, just because they're on a program doesn't mean that they get a meal 5 days a week, every day, all month long, year round. It just depends. Some of them are through Inclusive or iLife, get a meal, are eligible for a meal 2 or 3 times a week. Some of them are for 5 days. So these are estimates. Okay. And we have, Hayward has the largest number of people that are on programs. Hayward has 20 people on programs. Winter has 6. Excellent has 4, and Stone Lake only has 1 person on a program. So like I said, those numbers are, 1 to 2 months late because Shirley in the office has to have the numbers to include an iLife the 15th of the month. So then they get there. So sometimes it's a month to 2 months late. The SRC website is up and running. We're working on the updates and the corrections. We've had people look at them, tell us what they don't like, what they do like. So we're working on that. As of July 1, and there's a letter in your packet that was composed by FLAR with information that was given to them and that they collected. As of July 1, the SRC will no longer be renting the present site. Meals on Wheels and carryout meals will continue as they have been over the last 18 months, starting July 1. There'll be a new pickup sites for Meals on Wheels and carryouts, and I'm meeting with someone tomorrow to find out if that particular business or establishment in Winter is willing to do that. We are looking at the restaurant model in Winter We have a call out to a couple of restaurants. We called one back today. They wanted to know, one of their questions was, how much paperwork do they have to do? They have no paperwork. The paperwork is all at our end. All they have to do is submit their recipes, their menus to Pam. She will go over them. She will okay them, and then we can move forward. So, and Guar has asked that we do the restaurant model if we can find someone that is willing to be that site restaurant. And we try it out for 3 months, 1 day a week, and we can also expand if necessary. Some examples of the restaurant model is Econo Martin Spooner has breakfast every day that you can go there, the breakfast model. The one thing to understand with the restaurant model, right now, all of our sites, it's a suggested $5 donation. When we go to a restaurant model, those suggested donations could be higher. So they can range anywhere from $6 to $9. It depends upon the restaurant and the menu and stuff like that. So, and again, it's a suggested donation. It's their choice if they pay or not. Okay. The SRC board meeting is the 18th of May. Bingo at TNT. Our last one will be May 23rd, and on May 25th, we start at Red Schoolhouse Wines and Stone Lake, and it'll be burgers and bingo. They're going to have making burgers out on the grill. So lots of times people eat off the menu, but they're adding something else. So we'll have burgers and bingo this year. And that'll be 2 Wednesdays a month from 6 to 8.
Thank you.
Any questions for Joy? Anybody?
We have a public comment for
Yes,
for this one? Okay.
okay. Yeah, I
Oh,
know.
okay, okay.
I was about to say that.
Okay, sorry about that. Thought you were going to the agenda.
No?
Okay.
Louise?
Yeah, hi. The county board members that are here, not the board members who are not county board members. I'm wondering if you could raise your hand if you got my email at some point today on your SawyerCountyGov.org site. 1, 2, 3. Because I never used the Sawyer County Gov when I was using personal emails until I found out about the Sawyer County Gov one. I just want to make sure it worked because I live far away and I think sometimes it's important to communicate. So thank you for that. And the reason I asked to speak on that item on the agenda is because I'm from Winter, and unlike Stone Lake, Exland, and Hayward, where they can have exercise programs, art classes, cribbage, and bingo with burgers, in Winter, even if you do the restaurant model, we can't. We can't get together as seniors because our site the lease has been not renewed. We still want it open and we still want it renewed, and that's why I'm here. If you have any questions about the support of the people in that area, I'm willing to answer them. There are many people supporting the site opening, not closing. And on that note, then of course, the lease expires, I believe, at the end of June. So that would mean that at some point between now and the end of June, the Senior Resource Center has the ability to go in there and take all the equipment out, which if we get it so that we can reopen the place on July 1 and the equipment is gone and we get the money to hire a good cook, or we get more money to hire a cook, as I suggested in your email, there's all kinds of sources for money, many, including the one you can control, the American Rescue Plan money. If we sweeten the pot, and I did make a misspell, I said temp in there. If we sweeten the pot when we advertise for cooks, we might get cooks. We might. Because that's one of the reasons why they closed the site, is because they couldn't get anybody to apply for the job. And then the other reason is that according to Guar, is that it costs too much money. Well, our community had a meeting just over a week ago, and we had it in the village hall, and there were so many people we couldn't all fit in the room. So there is a lot of support. There's a lot of ideas rattling around down there to come up with some help to keep our site open. So please help us in any way you can. Please, please, please. And when I say we, I mean we. There are hundreds of us. The petition is still available if you want to see it. that started last fall that was signed by all kinds of people to keep Waldo in place so that we can have exercise, art, cribbage, bingo with
Yeah.
burgers,
10 seconds. Louise.
and socialization. And one other comment then is that when Joey says that she has a compilation of comments from GWAR in a letter form, I would expect that the letter form would look like a letter and there would be a signature on it, and there isn't.
Okay, that's your time is
So
up
I sure
now.
wish that,
Thank you.
I sure wish that there would be. And I've asked for a copy of the
You're-
letter
you're
with a
done.
signature,
You're
and I
done.
can't get one. I'm almost done, sir.
You're done
I'm
now.
almost done.
No, you've had your 3 minutes. Okay. All right. The resolution authorizing transfer of, I did. Can you tell us about this resolution? Just the one we've been working on for several months.
Joy, you want to? You do.
Oh, you want me to, okay.
Yeah.
There's two different grants through the state. There's the AFCSP, and that's the one that we're asking a resolution for. Up to this point, we've had the NFCSP, and the NFCSP is the National Family Caregiver Support, and the AFCPS is the Alzheimer's Caregiver Support Program. The county always had that. About a year and a half ago, Lori approached me and said, as long as you already have the NFCSP, we call it the N and the A grant across the street, you might as well do the A one because they're comparable. In order for the state to transfer that money to us and for us to transfer it to GWAR so it becomes part of our claim system, we have to have a resolution from the county. And I did bring with me, for those of you that aren't familiar with the programs, I brought the fact sheet so you might, better understand. Because what has happened is a couple different things. We are administering the AFCSP without any money because this hasn't been, figured out and settled or whatever. And the other thing is the money would come in very handy because, like everything else, it's hard finding individuals and people to do some of the caregiving that we need to have done for the program. So it's a matter of the two programs complement one another and bringing them together. Rather than having, because some of this programs and the things that we support are the same between the two. So why not have them under one house rather than in two separate houses?
Can I have a copy?
Oh, sure.
Thank you.
Anybody have any questions about the resolution? We've seen it before, so just kind of hoping we can get taken those tonight. Any concerns? You're familiar with it.
No, I think it's a good thing.
We need a motion to,
Motion to accept that we pass this resolution.
and we have a second. Now, do we need a supermajority? Just a majority. Okay, any further discussion? Okay, all in favor, say aye.
Aye.
Any opposed? Motion carried. Thank you. Thank you, Joy.
You're welcome. Thank you.
Okay. Administration.
Okay, I'm Paul Grahovac, Health and Human Services Director. Excuse me. I talked to our county administrator about how to proceed tonight because I know we didn't have a board chair. We were going to shift and we had all these new board members. I wasn't expecting Mr. Schupman here tonight. So I was kind of brainstorming how are we going to proceed tonight. This department is very complex. We could take any unit and any program in the unit and spend a whole night, a whole year on it. And I was talking to our administration team, our supervisors, what do you think we ought to do? What we've done in the past is, first of all, back to the introductions. When you see introduction, think orientation too. But I didn't know that you're going to do introductions tonight. So I thought since we had all these new supervisors, we do introductions, but you already did them for us. But I'm trying to think about how do we move forward? Because on this report, we have reports from the different units, but I don't think they're going to make sense to you without having an idea of what Health and Human Services is. So what we've done in the past, by the way, I have binders for all the new county board supervisors. This is in there. We have an outline of all the different units within the department, and we have the unit supervisors go through and explain the programs. It's hard to get a balance about how much depth you want as opposed to breadth. I know there was one supervisor within the last several years, this was a lot of information, the person just stopped coming. So it's hard for me to know how much everybody's going to want to know in order to move forward, being a member of this board. So one of the things I'm thinking about, I don't know what you want to do, Mr.
You're
Chairman.
doing fine.
Okay, I know what you want to do, but I'm just, I have some of the supervisors, I think they're all here tonight, except for one. I was thinking more of planning for next time to have the supervisors to be here to formally present what their unit does and follow this outline so these reports make a little more sense to you. And they can present their reports during that time as well, so it can be all together. And I also want to back up, and I talked to Mr. Alvarado about this, and it's with the Senior Resource Center. I should give you a little background on this, because it's going to be helpful to how we move forward talking about health and human services. And Joey, if I miss anything, let me know. Because I think it's important you know this. There's a difference between the Senior Resource Center and the aging unit. By statute, the county has to have an aging unit. You can have it within the county as its own standalone department. Lots of them have them in health and human services, or you can contract out. Okay, so the county decided years ago to contract, we have an MOU with the Senior Resource Center to provide the aging unit services. Does that make sense? Because there's a difference between the Senior Resource Center and the aging unit. The complicated factor is a little bit more, and we've been working on this. I've been here a little over 9 years, is we never could find the original contractor or the MOU or the agreement, and we finally put one together. So there's one in place now about what that relationship means. But I also want you to know, this is sound kind of convoluted. There's one of the services that the aging unit has to provide is the elderly benefit specialist. Okay, but we had an agreement with the Senior Resource Center a few years ago to bring the elderly benefit specialist, aka EBS, into the county. House it in the county. So in essence, the county is contracting with the contractor to have that position within the county. So when Lori Perlick goes over the long-term care unit, just know that the EBS is really part of the aging unit who we contract with. We're contracting with them to have that position within the county. And if you think that's convoluted, as we peel the onion back with some of these programs, this is just the tip of the iceberg. This is why going through this, I don't know how much detail you're going to want as we go along, but I think it would be helpful next time for sure is to have each supervisor give you an overview of their unit. And for the other board members that have been here in the past, has that been helpful to have them?
Yeah.
Absolutely.
And maybe expand on your mandated services, Paul, and that this is one of the largest budgets within the county as well.
And as you probably know, one of the big ticket items here are the out of county placements, both the child and youth placements and the mental health placements. And there's only so much we can control. We will talk to you about that process, and we can go into as much detail as you possibly want to know. Joe Bodo, our longtime behavioral health coordinator, he within the last few years he had a very long detailed presentation about what it takes to have somebody placed and all the crisis stuff that go. But if you want to go to that much detail at some point, we can do that. But that's not for tonight. So I had no idea how this meeting was going to go tonight, and I thought if we did introductions, I'm just going to throw this out there. You can poo-poo it, whatever you want to do. But I was curious with the board members, and I know our supervisors were about 3 questions, and I don't know if you want to entertain these questions and move forward with these, but one of the things that would be helpful for us to discern how much information to pass on to you is first of all, we'd like to know, what is your understanding of Health and Human Services? What is your interest in serving on this board? And the other one is, what do you want, need to know from us? Because there's a ton of information we can give you. And I would ask Mr. Sleater and Mr. Schumann or anybody else on the board, you've been through this before. What do you think is the best way to disseminate this information?
From my personal experience, it's real easy to have too much thrown at you in too short of a time, because it just, well, my brain ain't capable. The thing though that happens is, if way back when I got on this board, we did have what Paul is suggesting, short presentation by each department head, not going into great detail, but just telling what that department is responsible for, what part of it's are mandated, what part of it's are we providing because we want to. And then whenever any department comes up with a special item on our agenda, then it might be time to peel back the onion. And if you ever get to a point, whether it's Child Protective Services or whatever department, and they're talking, okay, I'm not sure what those acronyms mean. I'm not sure what is that all about. Stop us and we can fill you in at that moment. And that becomes what I think is a more teachable moment than trying to remember everything presented on the same night or in short order. So if we could just go with what you're saying, a short presentation from 5 of them, right? From 5, or we could do 1 a month. That's up to the board, what your pleasure is. But just remember, if you don't catch it all the first time around, and we are discussing it later in the future, stop us and ask for an explanation.
How many supervisors will be at the next meeting? You have a number?
I think about 7 of them, 6, 7.
Maybe
I think they're all here tonight except for Carla.
So to break it down and get just the factual information of what the program is and what it serves and what's mandated, what's not, what's budgeted, what's billable, that's quite a bit in itself right there. So maybe rather than 7 people at one meeting, lessen it to 3, because I think there's going to be questions from the new members not knowing the acronyms. Why is the budget here? Why is there expense here? How is it billed? So I think that's a lot for 7 supervisors to present in one meeting.
I
That's my
agree.
thought.
What do you think, Jesse?
So I don't have a lot of knowledge on a lot of these programs, I'll be honest. So what I'm looking for is not every, deep dive detail and nuances and emotions on every program and an element within HHS, but I need enough data and facts to make informed decisions when it comes time to vote. So that's what, so if we can get some briefings that are just, here's, who we are and what we do, and just without going into all these idiosyncrasies that are important, and I will learn those, but for the next couple of months, I'm looking for facts to make informed decisions, because I want to make good decisions, and I need some details and some factual data to do that, not a lot of emotion from different organizations. And that's me personally. But the acronym, I don't know if the acronym list is in there, but I've already heard several tonight that I don't know what they are.
We have in these handouts, we do have the acronyms are spelled out of the different programs. And even on the reports, they're spelled out too.
Perfect.
Okay.
But can I add, by the way, you're gonna learn there's a lot of programs that start with a C. I have no why, I don't know why. But let's see who's. Pardon?
This is board member Dawn Kennedy.
No, I'm wondering how we want to go through this tonight.
Looks like Lori's on, Alicia's on, for department supervisors.
Why don't? I'm gonna ask, it'd be okay if Lori's available for have her go over the adult long-term care and she can go over a report tonight just to kind of get a start and see how that goes. She's online.
Sure.
Okay.
Lori, are you okay with doing that tonight? Oh,
We can't hear you.
Can I-
We can see you, we can't hear you, Lori.
can I hand these out to the new board members first?
Sure.
Show what the page is. Here's
Can you hear me now?
There we go.
All right. Can you pull up the report on the screen? I'll see if I can get it. I'm having some technical issues here.
All right.
I can't open anything from the agenda on the screens.
Here's the. Yep.
All right. So I have not had the opportunity to meet. My name is Lori Perlich. I am the adult long-term care supervisor. The adult long-term care unit consists of the Aging and Disability Resource Center of the North Sawyer County branch, which I manage, and Adult Protective Services. In addition to that, I am a half-time information and assistance specialist for the Aging and Disability Resource Center of the North. And I know you can all read, so I'll just try and hit the high points of my report. The Aging and Disability Resource Center of the North Director, Coordinator Laura Compton resigned, and the ADRC has selected a new Director, Admin Coordinator. Her name is Natasha McFadden. She works out of the Ashland branch. The ADRC of the North consists of Sawyer, Bayfield, Ashland, Iron, and Price counties. So she will be taking the helm for our ADRC. We are looking at returning to services as usual. The Bureau of Aging and Disability Resources, which is our parent company or parent organization at the state, has announced plans. They are referring to this as unwinding. How that will affect us locally is that there are a number of individuals whose Medicaid determinations have basically been put on, or their coverage has basically been put on hold. So during the pandemic, during the public health emergency, anyone who became eligible for Medicaid has continued to have those Medicaid services continued throughout this public health emergency. So as this unwinding goes forward, there will be a number of individuals who may be losing Medicaid eligibility, who may all of a sudden have cost shares related to remaining in their long-term care programs. So we are anticipating, as this unwinding is happening, that there'll be a number of referrals to the Aging and Disability Resource Center, to offer disenrollment counseling to individuals who may want to leave the long-term care programs. But we also anticipate that the elder benefit specialist and the disability benefit specialist will be very busy assisting clients with renewing and with providing the information to retain that Medicaid eligibility. At this point, that unwinding is anticipated to begin in July, barring an extension of the public health emergency. As far as adult protective services, Paul, can you roll that up? Thank you. We continue to recruit for the open halftime adult protective services specialist. We are working with law enforcement. The state agencies have offered our interdisciplinary teams for adult protective services the opportunity to have some specialized training offered to our law enforcement agencies. So we continue to work with our partners, which are the Sawyer County Sheriff's Department, the LCO Police Department, and the City of Hayward Police Department to offer them this specialized training. Plans are in the works for the unit to move to the building that formerly housed the Oasis program. I've been referring to this as the Sawyer County Annex building. Construction continues to go on, and we hope to be in that building soon. It will offer us a lot of great opportunities to offer trainings in to large groups that we don't have that opportunity to do at this time, and also to be the warm and welcoming atmosphere that ADRCs are based upon. Any questions?
I don't see any hands.
Lori, I don't know if you have it in front of you, but probably not, but I could read the bullet points. We're trying to do the overview too right now for a couple of the supervisors. So the new supervisors new county supervisors have this, county board supervisors have this in front of them. So it's the tier 1 and the tier 2 stuff. Do you have that by any chance?
Let me try into my email here, and I should have a copy of it.
Just run through that and explain what that is, and then that will take care of that overview. So, Carol made a good point. Probably can't do 7 of these in a night.
No.
Well, if you want to stay until midnight.
No, that's pretty good.
I think one thing that is confusing, that's important for new members to realize is these programs are so interconnected with each other. One program may be mandated and another not, but the services that are required for an individual or client, they mesh together, and it gets pretty complicated sometimes trying to figure out how to fund them and keep them lively and serve people.
Well, on this handout, you're going to still, please have it. The tier 1, those are mandated services, the things we have to do. Tier 2, these aren't mandated, but it supports the other ones. And if you didn't do it,
Right.
for instance, we talk, maybe I think next month we'll do the behavioral health component of it. But just talk about the mental health. We don't have to do community support services. CSP for the chronically mentally ill. But if we didn't have that program, we have 55 to 60 chronically mentally ill individuals in that program. If we didn't have that service, any one of those individuals happens to decompensate. Again, we care about them, but there's also a cost to it. Then they get placed outside the county. A lot of times in Winnebago at a tune of about $1,300 to $1,400 a day. So, well, we'll get into that next time, but that's an example of what Carol's talking about. We don't have to do CSP, but virtually every county does it, and we'd be in trouble if we didn't.
We couldn't afford.
When you,
Yeah.
did you find it, Lori?
I did. I got the uncorrected copy, so hopefully I'll remember
You want me to read the bullet points? I could just say the name and you can just comment on it. The first one is information and assistance.
So the Aging and Disability Resource Centers are the first step to accessing the publicly funded long-term care programs. So our information and assistance specialists are trained to provide information about whatever program may exist to meet the elderly and the people with disabilities in our communities.
Options counseling.
The options counseling is actually the fine tuning of information and assistance. So the information and assistance specialist will meet with the individuals and or family members and really get into the specifics of what an individual's needs are. We're going to investigate what their desires are, for example, whether they want to remain in their home or whether their goal is to move to assisted living. We help them identify those natural supports they have. We help them determine how to get to the goals they may need to reach. Part of the options counseling is to discuss those publicly funded long-term care programs, give people an opportunity to understand them so they can decide and be an informed consumer about whether or not they want to participate in those programs.
Eligibility screening.
So again, this comes down to those publicly funded long-term care programs for the information and assistance specialist. To be eligible, the person has to have Medicaid and also be functionally eligible. But our benefit specialists also receive very detailed training about all types of benefits and can assist the clients with looking at those benefits and determining what they may or may not be eligible for.
Enrollment counseling.
Enrollment counseling goes back to those publicly funded programs. Once an individual is determined eligible, we go through in detail what those programs are to help them select which of the 2 long-term care programs they may want to be enrolled in.
The pre-admission screen.
So those are for individuals who are considering going into a nursing home. Just help them decide if that makes the most sense financially, what some of the implications may be, and also helping them determine eligibility for pay sources to fund a nursing home stay.
Disability benefit specialist.
So our disability benefit specialist works with individuals between the ages of 17 and a half up to the age of 60. They can assist with applications for disability benefits. They can help with appeals. They can all the way up to and including administrative law judge hearings. They can also assess individuals for other benefits that they may be entitled to and help with the application process.
Elder benefit specialist.
As Paul alluded to earlier, because the ADRC in the county is the employer of the elder benefit specialist, we are able to use those services to leverage Medicaid dollars. So the elder benefit specialist mirrors in a lot of ways a disability benefit specialist, except they serve individuals 60 and older. Both of the benefit specialists are also highly trained in Medicare programs and can assist individuals to understand what Medicare is, how it operates, assist with selecting Medicare Part D, which is the drug benefit, assisting residents to choose the most cost-effective plans available to them and understand what their options are for insurances.
Dementia care specialist.
This is a new addition to the Aging and Disability Resource Center. Up until this year, all 5 counties shared 1 dementia care specialist. We now have 2.5 FT full-time equivalent throughout the ADRC. So Sawyer County has its own half-time dementia care specialist. This is an individual who can assist individuals to understand the dementia process and their family caregivers. They can provide hands-on assistance to families who are in the dementia journey. They can assist with trainings on dementia-friendly communities, dementia-friendly businesses, music and memory, and other caregiver programs.
SSIE eligibility assessment.
So the state has tasked all counties, and in our county, it's through the Aging and Disability Resource Center, to screen eligibility for the Supplemental Security E-benefit, which is the, gotta dig through my brain cells here what the E stands for. Been a while. So it's an additional benefit to the state and the federal exceptional expense benefit. So the ADRC screens individuals to determine if they require the amount of assistance to qualify for the exceptional expense benefit, and then also do the annual reviews to make sure the person continues to need that level of care.
Resident review.
I'm sorry?
Resident review. Resident review.
Still didn't catch it.
Resident review.
Not sure what that one is. That's not one that should be on there. Oh, residency reviews.
That's what it is.
So when an individual applies for publicly funded long-term care programs, the ADRC is tasked with making sure they meet all residency requirements in order to be able to serve them.
You got residency, you got that. Sorry about that. We'll take one there. All right. Thank you, Lori. Let's go to Adult Protective Services, Tier 1, elder abuse and adults at risk. You have an investigation, prosecution, education, short-term case management.
That's everything. So again, all reports of abuse or neglect related to elders must be investigated. And then the services can be offered to the individual. All programs are voluntary. So again, a lot of times there is an expectation that adult protective services are there to fix things. But unfortunately, the reality is if the individual understands what their risks are and can make a competent decision about whether or not they're willing to accept those risks, the role of the ADR, or the Adult Protective Services, is to offer them those services and try and convince them that by accepting services, we can help them complete or maintain their independence. We also work closely with law enforcement, and when abuse or neglect is identified, we can make referrals for enforcement and for prosecution.
Your next bullet point is protective services.
So protective, I'm going to presume we're talking about, so protective services are things that we can use through the court to compel an individual to accept services when they are a risk to themselves or others. So among the protective services might include protective placement. A good example of when we use protective placements is someone whose dementia has progressed to the point where they are no longer capable of providing their own basic needs. They need to be in a facility such as a nursing home where that 24-hour care can be provided, but the individual is unwilling or unable to recognize their need for that level of care. So the county can work through the court system to have orders in place to protectively place that individual so that they can receive the care that they need, and also so that the nursing home has the ability to keep the individual there when the individual may not want to remain in a nursing home or other facility.
The next bullet point is guardianship, and you have a lot of qualifiers. You want me to read those to you? Qualifiers?
Well, as far as guardianship, the ADRC the Adult Protective Services provides information about the guardianship process, alternatives to guardianship, because we do, again, want to emphasize what the least restrictive measures are to keep the individual as independent as possible. So the Adult Protective Services can provide information, and in some cases where there is indigency, the county may be the petitioner for a guardianship process.
Okay, your next bullet point, you may have covered this under protective services, but it says protective placement.
Yeah, that I was alluding to protective placement as one of the many different protective services that we have in our arsenal to help protect an individual.
And then the APS interdisciplinary team meetings.
So the agency is the facilitator for our interdisciplinary meetings. We meet quarterly. The members are the law enforcement I alluded to earlier. We also have the DA, the district attorney invited to those meetings. We invite housing representatives. We have representatives from the managed care organizations, such as Family Care and IRIS, which are those adult long-term care programs. We have representatives from the clergy. We try and get representatives whenever possible from our banking industry and other community groups. Our medical community is invited to participate in these meetings. The meetings are held to identify those difficult issues, to have an open forum where we can discuss and have conversations about cases or troubleshoot some of those situations that are more difficult to handle on one-on-one, some of those mutual consumers that are seen by a number of different agencies. This is our opportunity to sit down together and make sure that we are serving and not duplicating services.
Okay, and then the tier 2 service, I'll just read each of those services. You can comment on them, please. Dementia Friendly Wisconsin.
So Dementia Friendly Wisconsin is the state effort to raise awareness about dementia in the communities and to make our communities an open and welcoming place for individuals with dementia.
Powerful tools for caregiver training.
So we have trainers within the Aging and Disability Resource Center, including our dementia care specialists, who are trainers for the powerful tools for caregiver programs. We try and present training twice a year. With COVID, those trainings went to a virtual platform and were available across the state. And so this year, once unwinding is in process, we once again have those trainings available.
Dementia Friendly Business Training.
And that's a service of the dementia care specialist as part of the dementia care plan for the ADRC of the North. That is in one area where they want to increase focus. The dementia care specialist actually goes into businesses and works with their employees and trains them on how to identify dementia, how to work with people with dementia, and just then be able to advertise themselves as a dementia-friendly business and display signs so individuals know that that's an area that has the employees trained to understand people with dementia.
And the final one is Music and Memory Program.
So Music and Memory is another of the dementia care programs that we're in the process of implementing here in Sawyer County. This is an evidence-based program that allows individuals to have their specialized music programs that they can listen to, because we discovered that a lot of times with people with dementia respond really well to music. And it's a really good tool to use to bring people who may not be living in the present to be able to communicate with loved ones and to just have that bridge to meet the person with dementia wherever they may be on their dementia journey.
Okay, thank you, Lori. Any questions for Lori? It's the overview, an overview. So,
Okay, everybody take out a pencil and a piece of paper. We're going to have a quiz.
I have a question. So
Yeah.
which of the 5 programs that we're going to hear about contributes to the most of those out-of-county placements that you spoke of that's so expensive? Is that, would they be from the aging, from the adult?
could be.
So you don't have a number of like which program contributes the most out-of-county placements?
The mental health and the child and youth placements.
Mental health.
And we have reports for that you can, I have been done my best to be as transparent about those costs to this board and every month, so that when we do the budget, it's not a surprise. So I will, as we go through that, I'll explain that, what you're asking for, but we'll get to it all tonight. But that's coming. I want you to know that. I want you to know it, and I want you to know that stuff because it's important. It's a big cost. It's a big cost. And there's stuff that we just don't have control over. Now, there'll be some emotion in that one. So I get to that. But all right, is that enough for an orientation for one unit tonight?
I think so.
Okay. Maybe what I can do is I'll just reference the reports on here, what you can expect moving forward, okay? On the behavioral health reports, Alicia Carlson, our supervisor there, she usually submits a monthly report. She did submit one, but I was waiting for the modified mental health placement report by one of our staff, and that'll be ready next month. So I'll have both those reports next month. And that mental health cost by client, Mr. Betcher, is really something you're going to want to look at. That's going to answer some of those questions. Okay. Child Protective Services right now on the CPS report, we kind of give you case numbers to kind of give you an idea, who we're serving and what we're serving. And then related to that other the placement cost, Mr. Betcher, is the substitute care report about the child and youth placements and the cost. And when we get to that report next time and go into detail, I can explain the different sections. And you will notice, if you look at the RCC, the residential care centers, those are the big costs. The kids go there. And then the next one, youth justice report, Carly usually gives you a caseload numbers, what's going on there. Economic support, Shauna White, who's right there, our economic support supervisor. When she gives her report on this down the road, we'll explain we're in a 12 county consortium. And so this information is related to those all those 12 counties. And then Julia Lyons, I think you know her, our public health officer.
We've met.
She has a report. Is there anything you want to comment on that tonight? And then last but not least are the fiscal reports compiled by Patty Dujardin, right, our financial manager extraordinaire.
I can,
Sure.
one of the reports that you get, one of them is the purchase service recap. Okay. So in our budget, when you see our budget, the biggest line item in most of the units is what we call purchase service, which we're purchasing service from out of county, or it's not performed by us. Otherwise, it's staffing costs, number one, purchase, to that. But if you look on this recap, which is a report that I do to give you in a nutshell where we're at in spending, if you just look at the budget, that will tell you where we're projecting to spend our money. So under the AODA, under state mental health hospitalizations, we budgeted 1.1 million. Under children and family, so under family services, between foster, group home, And RCC, and that's residential caring center, as Paul said, that's another over $1 million. And so this is what we've actually spent every month. However, it is a month behind because a lot of the reports that we get or when we pay the bill, like right now in May, I'm paying April. So we're a month behind. And the state mental health hospital, we just now in May are paying January. That's how far behind we are. It comes through and we don't get our bill for that.
Yeah, it's
So
not that,
you aren't seeing this in true time, but this is showing you where we're at compared to your other reports that you have at any time.
it's not that you're behind, it's they're behind in getting the
Correct,
information to you.
right.
And it sounded like you were at fault, but that's not the
Oh,
case.
right. Well, I mean, like, of course, you have to wait till the month is done
Yeah.
and then you pay the bills.
Mhm.
So, I mean, by the time it hits for most. However, the state mental health hospital, we just now in May got January's bill.
Mhm.
So that's, this report can help you see where we're budgeting and projecting to spend. And again, this is only purchase services. This is only the cost to contract for services, not our staffing costs.
Patty, so we budgeted 1.1 million for 22. What did we budget for 21? And did we hit that or did we exceed
Oh,
that?
we way exceeded it. We increased our budget for 2022 dramatically. So we way overshot what we were projecting. That's why we increased. We actually increased our budget quite dramatically in 2022 for the family services out-of-home placements and for the state mental health institution placements to get it more realistic. So I would have to say that the budget for 2022 is probably the most realistic budget that we've had since I've been here. In 33 years. I believe that it was a true realistic budget this year.
I'll give you a heads up. I don't want to go any demographic information to identify the person, but I can tell you that Joe and I and Carol Lund over at, she runs our CSP program, community support program for chronically and mentally ill. I want to limit the details, but we've had a person placed and we have been meeting on a weekly basis and so I'm going to go sit down. There's a long-term placement coming up and we have had difficult time finding someone to take this individual. We narrowed it down to two. One of them, it changed today. I'll tell you what, it was started out at $1,700 a day, which had been over $620,000 a year for one individual. Joe tried working with him to see if he'd renegotiate. He went back and met with the person and came back with this figure today, $2,021 per day. So that's, however, we do have one that we're going to try, and we're just in the beginning stages of moving forward. It's $990 a day, so a little over $361 right off the bat for one person in the budget. So let's let you know, as I let Mr. Alvarado know, this is coming down the pike, and we don't know if it's going to work. And if it doesn't work, they may have to find some other place to put this individual where the cost will go up. This is where down the road the emotional will come in, because they've heard me on the board is there are gaps within the system, within the state, that these counties, we cannot afford this cost, obviously. And I don't know what's going to happen down the road. You know, we've talked to our legislators down in Madison, down there multiple times, but I'll stop right there. But it's an issue that's been on our radar, and it's very difficult to get things to move. But this is the reality. And Joe and Carol Lund have been working a tail off on this one to find a reasonable placement.
Yeah, and just
we've talked about this, and just to go to the discussion about the more reasonable budgeting this year. Last year, you essentially ran down there's a reserve fund, I'll call it a risk reserve fund, these out-of-county placements, because you really don't know when they're coming. You really don't have any control over them, and you have limited options of where they can be placed, and they're all expensive. So the reserve fund you had has been run down to very little, which is why it was important. And we'll be talking about that later this week, but that's why it's important to have a reasonable amount in the budget this year from this type of placement.
And if you want more good news, I got to be real brief on this one, is Joe let me know that there's somebody that came into our county from out of state that might be in the same ballpark. So
And that's the problem.
that's,
I mean,
we have,
Yeah, hang on a second. Tweet.
2 more, 3 more, who knows? At $1 million a year, supporting their needs. The county pays.
Patty, does any insurance cover this?
Yes, if they have it. Medicaid cuts off as soon as they go into a state mental hospital. The person that Paul is alluding to that has been in Winnebago for a few years did have insurance through a parent, but their lifetime maximum has been reached and we will receive no more. And then there's nothing.
Well, one thing that we are working on is the Wisconsin Counties Association has a program called the Community County Ambassadors Program. And it got waylaid during the pandemic because nobody could travel, so on and so forth. But it's 3-4 of us at a time going down to Madison, and we have pre-scheduled visits with our state representatives, both in the Senate and the Assembly. And we talk with them about the major issues that we are facing. And this has been on that program for quite a few years now. And it's finally starting to get nudged into some action. The Wisconsin Counties Association is paying a little more attention to it. We met with not Julie, the other guy, Petrowski, thank you. And he asked us to, do we have any possible solutions, anything that could smooth this out? And we came up with statewide suggestions. Maybe the county, based upon the whatever equation you want to use, net value of the county, the population, whatever, each county would pay so much and when for these placements, and then anything over that would come out of a pot that the state provides. That was just one of them. There is some variations on that. We are trying to work on it, but it's a long, slow process getting the legislature to move.
Hand up for Ms. Pettit.
Ms. Pettit? Ms. Pettit, go ahead.
Yes, gentlemen and ladies. I've made this suggestion in the past and it gets mulled over and then it says, we can't do this, we can't do this. But I sat on this as a supervisor for the last 2 years and watched what has happened to our community and throughout the nation. It's a state level and a federal level. Counties like ours all across the United States are going to go belly up if something does not happen. It's been a slow moving process for the last 20 years. This is not going to be resolved until doors start being knocked down. And if that means going to, as small communities like we are, going to the press and getting big, like out of Madison, you go to Chicago, you go to Minneapolis, You get big and show what is happening, what little counties like ourselves are faced with. This isn't going to change. This is the same discussion we've had for the last 2 years. And the price tag is getting bigger and bigger. And with COVID, the opiate epidemic, and all of that, it's compounding and things aren't getting any better. It is going downhill quicker and quicker, and we have more people dying. How many more loved ones from the LCO tribe are we going to bury this year? Because that number is so absorbent, I can't even, it boils my blood. And how many children are in foster care because their parents aren't able to take care of them because they're mentally ill, they're addicted, or they're alcohol issues, or the parents aren't there, or there's no one to take care of them. The funding, the housing isn't available. It goes on and on and on. So somewhere down the line, and if it has to be me, since I sit on this board, but I am a community member, I will go to the press. I am so far done watching people get buried and family members. It is on a weekly basis somebody is getting buried off from the LCO tribe. It is absolutely beyond. This should not be happening in our community. It should not be happening anywhere. And we all can sit around this table and say, yep, it's going to cost us $632,000. It's not funny. This is someone's loved one. There's children in foster care that are 8 years old that are in a facility. No 8-year-old child should be in a facility at all. That just because there's no one there. We have people that need to step up. There's families that would foster outside if they're not Native American, outside if they're not Hispanic. It becomes what we need to do for our community. There should not be an 8-year-old child in the system that is put into a group home or something, that pending that they don't need that just because there's no other placement for them. And I have a 12-year-old daughter. I live in Winter. I've represented Winter as best I could. The Senior Resource Center, which I fought tooth and nail for not to close, because this will be another nail in the coffin down here. And the amount of people from the lower end of the southern end of the district that are addicted, mentally ill, you don't even tap the source seeing what's happening. So if I have to go to publicly, I will go public and say this is what's happening, and us as little small counties cannot afford to do this anymore. Something has to happen at the state and the Fed level. They can't just keep saying, yes, we're going to see you, we'll meet with you, the legislative, and that just nothing ever happens. For 2 years I've listened to it. That's just my rant. And Joe knows how I feel, Paul knows how I feel, but it's beyond okay anymore.
Okay, thank you, Dawn. Somebody have their hand up over here.
Oh,
Patty.
I was just gonna say, on the bright side. What I was gonna say is that talking with our legislature has, in the past few years, done some good.
Yeah, it
And
does.
if everybody remembers, 3 years ago, we got a huge increase across the state for Child Protective Services. They did a caseload study and set limits of how many cases each Child Protective Services or CPS worker could have. They put that into place and they gave them funding to back that up. This year, they actually put more money into that program by paying for all subsidized guardianship placements. It's a small sliver of the children that we have in care, but they're covering 100% of that cost now. That was a Wisconsin Counties Association initiative, and it was by people going to the legislature and complaining about Child Protective Services and the cost going through the roof, and that it was going to break the back for that. So I did want to say good things come out of that.
Pardon? Can I have one comment?
You?
Yeah.
No, you're done.
I've
Go ahead.
I just want to, I'm not a longtime government worker. I've only been here for a little over 9 years. This is at the end of my career. Stuff does change. It's unbelievably glacier slow to get stuff done. It is so frustrating. It's very frustrating how difficult it is to get things moved. And that CPS thing, I was involved, it took like 4 years to get that. And I think these mental health cost placements, there's some movement, but it's slower than a glacier.
Okay, any future suggestions for future agenda items?
Chairman, I got Andy, our previous administrator, Mr. Hoff, he mentioned that some of these out-of-county placements that are court ordered, you can borrow money for. Is that true?
That is true.
And we've never gone down that road. We've gone down that road for capital projects, correct?
I don't know of any, I'd have to go look. I've not heard myself of any county that's gone down that road. But it is court ordered, yes.
Future agenda items requested in the pledge of allegiance on I know some committees do, some committees don't. I'm not sure why everybody doesn't. If that's
And I think at public safety, they announced that they'd like to see back on all agendas. Let's put it back on the template. Should show up in June.
Thank you. Anybody else? We're adjourned.
I have a signature needed by board members, so don't sneak off the door.